I'm Jonathan Chung, and today we're going to talk about different types of pain. On the previous video, I've discussed heavily the idea of central sensitization and how pain can come from a dysfunction from the central nervous system, like the brain or spinal cord, and how this is a connection problem between neurons. So I'll let you guys go back and take a look at that because that helps to explain a lot of chronic pain processes. Today we're going to discuss nociceptive pain, inflammatory pain, and neuropathic pain because those conditions can have a wide spectrum on the responsiveness to different therapies and how we can try to identify which of these are more likely to succeed with something like chiropractic and rehab, or which other types of pain may not be as responsive towards these types of therapies. When we think about pain, we classically think about nociceptive pain, which is pain related usually to tissue damage of some sort. So next to all of our body tissues, whether they are bone, whether it's skin, whether it's muscle, or even inside of our internal organ systems, we have these receptors called nociceptors that detect chemical, mechanical irritants. So when these receptors pick up information, it's basically a signal that says something might be wrong here. So that signal travels down through the nerve, goes into the spinal cord, and shoots up to the brain. And if it crosses a certain threshold, then we are going to perceive that as a painful stimulus. These types of pain, when it comes into the musculoskeletal system, are usually favorable because typically these injuries can be self-resolving and they are very responsive towards different therapies like chiropractic, physical therapy, and cognitive-based therapies. And they also tend to be self-resolving over time. Now, when they happen into an organic system like your heart, your digestive organs, or something internal, then it can be quite painful, and you do want to make sure that you see a doctor that can actually do something about addressing what may be potentially causing tissue damage inside the internal organ system, because that obviously would lead to something more serious. One main issue that is difficult to tackle from a chiropractic or therapy standpoint is inflammatory pain. So this is pain that can come from an aggressive response from the immune system. Now, all of us may experience inflammatory pain after a recent injury. So if you sprain your ankle, you sprain your neck, hurt your back, typically you're going to have an inflammatory process, but that inflammation is going to get out of your system. And by the time the inflammation gets out of your system, most people are going to feel better from that. But if you have an inflammatory disease in itself, talking about things like rheumatoid arthritis, lupus, psoriatic arthritis, or gout, then the inflammation from the disease process itself can create joint damage. And the joint damage that this creates can sometimes be permanent. And these are situations where the pain can be quite aggressive. They tend to follow specific patterns after some type of chemical stimulus or dietary stimulus, that your immune system gets riled up and starts to produce immune cells and immune activation that actually causes further damage to the body. So these are conditions that really do need something like a rheumatologist to help manage the acute inflammation bouts. And that's where things like lupus and rheumatoid arthritis, especially, there are immune modulating medications that can definitely reduce the amount of flare-ups and increase the quality of life for the patient with these types of disorders while you work on things like diet and other factors that contribute to inflammation. Then there's neuropathic pain, which is when there's actual damage to the nerve or the spinal cord itself, which can be quite severe in terms of what type of pain that it produces. So because there's damage to the peripheral nerve or the spinal cord, some of the pain that comes from this may actually be permanent. And these are situations where people may need to rely on types of medications like gabapentin or even opioids in order to keep some level of control over their pain. In a best case scenario, they can be responsive towards therapies that address central sensitization, but neuropathic pain often leads to central sensitization and creates this really bad feedback loop that can be quite difficult to treat. Knowing what type of pain someone is going through can be helpful in guiding treatment, but it can also be helpful in guiding treatment expectations, because as we just saw before, even when we know where the pain is coming from, like in the case of neuropathic pain, our results and our outcomes for that type of pain aren't always good. But if we do know the source of someone's pain, like if it came from an inflammatory disease, there are options for people to be able to get effective treatment from a medical standpoint, and also which may help guide rehab treatments as well.